So let's see hypothermia within 2 minutes. Hypothermia is, by definition, it's a core body temperature less than 35 degrees Celsius or less than 95 degree Fahrenheit. So there are a number of causes of hypothermia in ICU. Hypothermia is specifically very important for anesthetist while waking up the patient after anesthesia, specifically general anesthesia and from a cool temperature of OT. So in ICU, there are a number of causes of hypothermia, which includes cold exposure because of air conditioning, or low temperature, environmental temperature, or fulminant sepsis, drug-induced hypothermia, specifically alcohol intoxication, general anesthetics, sedatives, antihypertensives, decay, polytrauma, prolonged cardiac arrest, kidney failure, liver failure, aggressive IV fluids which are very cold also cause hypothermia, continuous intermittent hemodialysis also responsible for hypothermia, hypothalamic lesions like multiple sclerosis also causes hypothermia. So these are causes of hypothermia in ICU. These are the causes of hypothermia in ICU. Okay, so what is grading of hypothermia? So hypothermia is graded into three categories. Uh, Mild hypothermia, which is 32 to 35 degrees Celsius, moderate hypothermia, which is 28 to 32 degrees Celsius, and severe hypothermia, which is less than 28 degrees Celsius. So this is grading of hypothermia: mild, moderate, and severe. So what is clinical presentation of hypothermia? So we have already classified mild, moderate, and severe. According to that, clinical presentation is there. So mild hypothermia, there is shivering, cold extremities, pallor. So these are simple and not more severe symptoms of hypothermia. In case of moderate hypothermia, there is depressed mentation, or mentation is obtunded. Ataxia could be there, cardiac arrhythmias, bradyarrhythmia, and supraventricular tachycardia. Then hyporeflexia, hypoventilation can be presentation of moderate hypothermia, dilated pupil, peripheral vasoconstriction, and impalpable pulse. These are the clinical presentation of moderate hypothermia. So what happens in severe hypothermia? In severe hypothermia, there can be coma, pulmonary edema, and cardiac arrest, and ultimately death is there. So what are the lab findings, or what are the systems affected or lab findings in these hypothermia cases? So in lab findings, there can be renal failure, hepatic failure, acidosis can be there. There are chances of coagulopathy. ECG changes in hypothermia, it is a particular topic. It has to be mentioned. There are typical features of ECG in hypothermia, which include J waves, or also called as Osborn waves. This is nothing but positive deflection at QRS-ST junction in left ventricular leads in 80% of cases. It mimics new right bundle branch block, and it can persist for 12 to 24 hours after treatment of hypothermia. So how will you treat the hypothermia? Okay, so hypothermia can be treated by using different modalities, therapies for hypothermia and changes in temperature I have mentioned here. So we can do passive external warming, rewarming, using blankets or warm ambient environment, or humidified air. So it increase temperature in a level of 0.5 to 4 degrees Celsius per hour. In active external cooling, active external heating, we can use blankets, warm water immersion, or water packs. It increases temperature by 1 to 4 degrees Celsius per hour. In active internal warm humidified air at 42 degrees Celsius, warm IV fluids at 42 degrees Celsius, body cavity lavage with warm saline can be used. And there are few extracorporeal therapies which increases more temperature. So these are hemodialysis or hemoinfiltration, which increases core body temperature by 2 to 3 degrees Celsius. Continuous arteriovenous rewarming increases temperature by 3 to 4 degrees Celsius, and cardiopulmonary bypass, which increases more core temperature, that is 7 to 10 degrees Celsius. So cardiopulmonary bypass increases by 7 to 10 degrees Celsius. Other topic is induced hypothermia or therapeutic hypothermia or targeted temperature management. We will discuss next time.